Hello everyone, today we are gonna talk about diazepam or Valium. First, we will have a general idea about the drug, then we will talk about the mechanism of action, pharmacokinetic, medical uses, contraindication, overdose and drug interaction. First of all, let's talk about diazepam a little bit. So diazepam, first marketed as Valium. It's a medicine of the benzodiazepine family that typically produce a calming effect. It is commonly used to treat range of conditions including anxiety, seizures, alcohol withdrawal syndrome, benzodiazepine withdrawal syndrome, muscle spasm, trouble sleeping, and restless leg syndrome. It may also be used to cause memory loss during certain medical procedures. It can be taken by mouth, inserted into the rectum, injected into muscle, injected into a vein, or used as a nasal spray. First, mechanism of action of diazepam. How does the diazepam or Valium is working? First, I'm not gonna talk in details about this because I already bought for you a video. You can check it by clicking down on the right. You can see the video. You can check it anytime and know more in details about the mechanism of action. First, it facilitates the action of GABA in the central nervous system. Diazepam acts at GABA-A synapses. Synapses means a junction between two nerve cells, and its action is reducing spasticity is at least partly mediated in the spinal cord because it is somewhat effective in patients with cord transection. Although diazepam can be used in patients with muscle spasm of almost any origin, including local muscle trauma. It also produces sedation at the dose required to reduce muscle tone. The initial dosage is 4 milligrams daily, and it is gradually increased to a maximum of 60 milligrams daily.
The primary use of anxiolytic and hypnotic drugs is to treat anxiety and insomnia. Anxiety is generally defined as an emotional state characterized by excessive feelings of worry, fear, and nervousness, while insomnia is generally defined as the inability to initiate, maintain, or achieve restful sleep. Now, in order to gain better understanding of how anxiolytic and hypnotic drugs work, first we need to discuss the role of GABA in the central nervous system. So, gamma-aminobutyric acid, or GABA for short, is a major inhibitory neurotransmitter. What that means is that when GABA reaches and binds to a specific receptor located on a neuron, it reduces the activity level of that neuron and makes it less likely to fire its action potential. Now, GABA is recognized by both ligand-gated and G-protein-linked GABA receptors. In this lecture, we are gonna focus on the ligand-gated GABA receptor called GABA-A, as this is the main target of many anxiolytic and hypnotic agents. Now, the GABA-A receptor is made up of 5 subunit proteins arranged to form a central pore. These subunits have been labeled with Greek letters such as alpha, beta, gamma, and delta. The subunit composition of GABA-A receptors in the brain most frequently consists of 2 alpha subunits, 2 beta subunits, and 1 gamma or delta subunit. Furthermore, for each subunit, many other subtypes exist. The function of each GABA-A receptor depends on which subunit it contains. For example, GABA-A receptors containing alpha-1 subunit appear to be involved in sleep, while those that contain alpha-2 or alpha-3 appear to be involved in anxiety. Now, when 2 GABA molecules bind to the GABA-A receptor, conformational change is induced, which results in opening of the central pore that allows negatively charged chloride ions to rush into the cell. This in turn increases the negative charge inside the postsynaptic cell, which makes more difficult for an excitatory inputs to cause an action potential. Now, GABA-A receptors are present in high concentration in the limbic system. One part of the limbic system is the amygdala, which contains many neurons that use the neurotransmitter GABA to control feelings of fear and anxiety. In times of stress, excitatory neurons in the amygdala fire rapidly, sending excitatory signals to other areas of the brain. It is this type of firing that leads to feeling of panic or fear. The inhibitory interneurons in the amygdala regulate these emotions by releasing GABA. The release of GABA and its binding to postsynaptic receptors such as GABA-A inhibits the excitatory signals that result in feelings of anxiety and fear. GABA thus has a calming, tranquilizing effect on our emotions and prevents us from becoming overwhelmed in stressful situations. Now, in addition to a distinct binding site for the neurotransmitter GABA, the GABA-A receptor has also a site at which anxiolytic and hypnotic drugs bind. These drugs can be divided into three groups, that is, benzodiazepines, barbiturates, and non-benzodiazepine hypnotics. Let's now discuss these one by one in detail, starting with benzodiazepines. So, benzodiazepines get their name from their chemical structure, which includes a benzene ring fused to a diazepine ring. Their binding site appears to be the region between the alpha and gamma subunit on the GABA-A receptor. It's important to remember that benzodiazepines do not bind to the GABA recognition site located at the junction of the alpha and beta subunits, thereby they don't induce opening of the channel as directly as GABA. Instead, the binding of a benzodiazepine to its receptor site increases the affinity of GABA for the GABA binding site. This leads to increased frequency of the channel opening and in turn increased influx of chloride ions at the postsynaptic cell, which ultimately makes difficult for any excitatory inputs to cause an action potential. So when the excitatory signals caused by fear or stress are inhibited in this way, the result is decreased anxiety and greater feeling of calm. In addition to that, benzodiazepines can also produce mild muscle relaxation as a result of their action on GABA receptors in the spinal cord, cerebellum, and brainstem. The examples of benzodiazepines are alprazolam, chlordiazepoxide, clonazepam, diazepam, lorazepam, and temazepam. When it comes to side effects of benzodiazepines, the most common ones are related to their sedating and muscle relaxing action. They include drowsiness, dizziness, decreased alertness and concentration, as well as impairment of motor coordination.
And now we will talk about the pharmacokinetics. First, the absorption. The active ingredient of Valium is rapidly and completely absorbed from the digestive tract. Peak plasma concentration begin reached 30 to 90 minutes after oral administration. Intramuscular injection is likewise followed by complete absorption, though not always more rapidly than with oral administration. Secondly, the distribution. Diazepam and its metabolites are highly bounded to plasma proteins. It's about 98% of the drug is bounded. Diazepam and its metabolites cross the blood-brain barrier and the placenta. They are also detectable in breast milk in concentration approximately 10 to 20 of diazepam and 10 to 30% of nordiazepam. Of those in maternal plasma. The steady state volume of distribution is 0.8 to 1 liter per kilogram. The distribution half-life is up to 3 hours. Then the metabolism. Diazepam is metabolized to the pharmacologically active substance, which is nordiazepam, hydroxydiazepam, and oxazepam. Oxidative metabolism of diazepam depends on the CYP3A and CYP2C19 iso names. Oxazepam and temazepam are then conjugated to glucuronic acid. And finally, elimination. The elimination curve of diazepam is biphasic, consisting of an initial distribution phase with a half-life up to 3 hours and a terminal elimination phase with a half-life up to 48 hours. Elimination is mostly about 70% via the urine in the form of a free conjugated metabolites. The clearance of diazepam is 20 to 30 milliliter per minute.
Diazepam is mainly used to treat anesthesia, insomnia, panic attack, and symptoms of acute alcohol withdrawal. It's also used as a premedication for inciting sedation, anxiolysis, or amnesia before certain medical procedure. And diazepam had a number of uses include treatment of anesthesia, treatment of neurovegetative symptoms associated with withdrawal, treatment of a symptom of alcohol and opiate, and palliative treatment of stiff person syndrome, treatment of muscle spasms, preventive treatment of oxygen toxicity during hyperbaric oxygen therapy. Diazepam is used for the emergency treatment of eclampsia and almost used in alcohol withdrawal and seizure. And in the last, pre or positive prepare sedation, anxiolysis, or amnesia.
Now, let's talk about contraindication. Patients that we can describe diazepam for them. First, non-hypersensitivity to benzodiazepine. Then, severe respiratory failure and severe liver failure, sleep apnea syndrome, and benzodiazepine are not recommended for the primary treatment of psychotic disorders. Benzodiazepine should not be used for the treatment of depression or anxiety states related to depression, as such patients are at risk of suicide.
Toxicity or overdose of diazepam. Diazepam overdose occurs when someone takes more than the normal or requirement amount of this medicine. Overdose of diazepam is usually administered by the central nervous system depression, running from the drowsiness to the coma. In mild case, symptoms include drowsiness, confusion, and lethal. In more serious case, symptoms may include ataxia, diminished reflex, and hypotonia and hypertension and respiratory depression and coma and death. Overdose of diazepam is usually in combination with the other central nervous system depressant may be fatal and should be closely monitored. Missing or abusing diazepam can cause significant harm for and may result in potentially fatal overdose. The dose requirement to produce respiratory compress is difficult to quantity and depend on multiple factors including dosage, transient and age and constraints and even genetic. Patient with severe toxicity will present symptoms and catatonia and immediately aerial measurement and mechanical ventilation may be required. Effects in toxicity, they are trouble breathing or inhibited breathing, bloodshot fingernails and lips, confusion and disorientation and extreme deafness and blind vision and double vision. Drug interaction or the diazepam interaction. The most common drug interaction including sedative hypnotics are interaction with other central nervous system depressant drug, leading to addictive effect. This interaction have some therapeutic useless when this drug is used as defense in anesthesia practice. However, if not anticipated, such as interaction can lead to the serious sequence, including enhancement depression with the concomitant use of the many other drugs. Additive effects can be predicted with the concomitant use of alcohol previous and opioid analgesics and anticoagulants and penicillins. That less obvious, but just as important in the enhancement central nervous system depression, which a variety of antihistamines and anti-hypersensitive agents and antidepressant drug and triclinic classes interaction involving changing in the activity of the hepatic drug metabolizing enzymes in system have been succeeded.
At the end, these are the references we used in this presentation. I hope you enjoyed it and thanks for watching. This presentation is done by Marwa, Durar and Muhammad from Ibn Sina University in Sudan, supervised by Dr. Khalid.